private industry executive with experience in manufacturing and retail, and most recently I was the VP of HR. Thank you. The VP of HR and Medical Services at Merrill Steel in Schofield. The medical services part was added later after we had good success with healthcare. Didn't even care much about healthcare until about 6 years ago, and started digging in and seeing the cost and seeing all the suffering, and started problem solving and started having good success. Although a majority of employers have not gotten to that point and are still struggling greatly. Currently, I work at Team Sherrill Companies in Stevens Point. We are a retailer. We have about 60 stores, roughly 30 convenience stores, and some Subways, about 26, and some tire centers. And there I lead healthcare strategy as well, about 700 associates. So I'm also in central Wisconsin as part of that passion that developed over the last 6 years. I founded and lead a healthcare best practice group among employers and others to find ways to manage out of control costs and be able to provide good benefits to employees and families. We have about 50 employers in that and about 150 others, mostly providers, but various others who are interested in free market healthcare and improving healthcare for Wisconsin. So as part of that work, that passion developed, won some awards, the HR Professional of the Year for Central Wisconsin in 2019, the Healthcare Innovation Award in 2020, the National Employer Purchaser Healthcare Excellence Award in 2020, which previous winners were Disney, Boeing, and Walmart. My wife and I live in Mosinee. We've been there for about 6 years, and we are foster parents. We're the champion foster parents for Marathon County, and we're actively adopting little ones. We take in newborns, often addicted to drugs. And we started a nonprofit called NOAA. It's a foster closet, and we won the Governor's Award in 2020 as Foster Parents of the Year. The reason I share that is not to boast, but just to share my love for the community. So I've been listening to a lot of the discussion today and been making notes and kind of changed my notes a little bit. But one thing I'm hearing, I guess, is, I empathize greatly with those suffering. I hear it every day. I spoke to 30 associates last night at an event we had. I had a line of 6 people line up afterward as I talked free market and our strategy to make this reasonable and talk about non-transparency and so forth. I had a line of 6. One person said, I had an ER, I have a $65,000 bill. Another person's in line, I have a $6,500 bill and I haven't even been diagnosed yet. And it's on and on and on. So I guess my opinion would be that what I'm hearing today is that we have maybe an opportunity. Problems are just opportunities in disguise, according to my view of the world. But we have a problem to fix. I'm not sure it's a legislative problem to fix because we have 100 more problems behind that problem. And if we're going to have 100 laws, if law could have fixed this one, the federal law might have fixed that custody chain or that supply issue. If law can fix it, we wouldn't be taking in newborns with meth addiction because meth is illegal of the mothers being addicted to meth. So I'm not saying I'm against legislation in some cases, but it feels like we're not problem solving well. My first job out of grad school, I worked for a Toyota supplier. I watched Toyota come in and fix everything, turnover and huge new product issues. Just it was a mess and they took it to great. I got recruited to Toyota. It was 8,000 people. You're making 3,000 cars every 24 hours, and I learned root cause problem solving, which is really my secret today. It's their secret. They're the #1 automaker in the world, #1 in the US now. It's their secret, effective problem solving. And I'd like to believe that if we work together and solve problems effectively, then we'd do much better. However, I'm still seeing many things from the hospital systems that tell me they maybe don't have good intent, that they really want to add cost. One of those is the unwillingness to share prices. I asked the hospital to bundle 6 months ago, and they came back and they said, we're unable to do that. Bundling means saying how much for the knee surgery, not all the things, right? They said they're unable, not they're unwilling. They're unable. And I said, well, it's just adding 3 numbers, the surgeon, the facility, and the anesthesiologist. You can add 3 numbers, right? They weren't willing to do it. So lots of examples like that. Part of it is with misaligned incentives. When costs go up, certain entities make more, and the employer and the employees are always the one paying for it. as in this case here with this drug bill. We might get a flat tire, so we'll run the car with 8 tires and then we've got to pay for it, right? We're just not really problem solving at all. So I think that's part of it. I feel like with healthcare costs out of control, we're in an emergency state. If we're not there, we're approaching it. I use the word unsustainable. I've heard that come up many times today from both sides of this argument. I have a whole presentation on it. It's called Unsustainable. It means the rate we're going, we can't continue. And I'd like to believe this is really about patient care, but I don't see it. I believe it's about monopolizing another piece of healthcare. I looked on CCAP, a group of us looked, it was a couple of years ago, but in a 90-day period, 400 families had lawsuits against them for healthcare in a 90-day period from one system. 2/3, this is from the American Medical Journal Public Health Research, 2/3 of the bankruptcies in America are related to healthcare. 3 out of 4 of those had insurance. That means over the last 20 years, the health insurance plans have degraded so much that they're now just catastrophic. They're not really insurance. They call that functionally uninsured, right? It only covers your premium's $800. It gobbles up your paycheck, and your deductible is $6,000, $8,000, or $10,000. How in the world can you're paying for your medical care anyway, so what do? You avoid it and you get sicker. That's no good for anyone. Another statistic, by 2030, the average American family of 4 is expected, healthcare is expected to be 52% of their income. That's as much or more than the house payment or the auto payment. So this oath of do no harm, I've heard that come up today. Do no harm needs to apply to a person's financial stability as well. Overcharging and then often ending up in garnishment of wages and liens on home is no way for a nonprofit to act. These nonprofits, by the way, if you investigate their finances, often have tens of millions or hundreds of millions in the bank. I wish we could say that as a for-profit business. So recently, I called a local provider, and it was I wasn't even trying to play games or anything. I just, how much for this service that you do, by the way, 10 times a day. I didn't say that, but they know that. 10 times a day. They wouldn't tell me the price. I said, you're actually our preferred provider of all things, right? I mean, I just want to know. Well, they said, call the hospital system. I said, why would I call the hospital system? You do the work. And I wondered, I said, how do they know how to bill then if they don't know the price? And can I really trust you? I think the latter, my answer would be no, because you're intentionally not sharing a price that you do 10 times a day. And even if there's a little bit of variation, you're not sharing it. How can I shop? We don't, as someone said earlier, we don't shop for anything else that way. We won't tell you the price, but you have to shop here. That's a horrible situation. That's why we are where we are. I can get, in the little bit I do shop, if I go independently, I can get an MRI for $600 that the same truck drives to the system and they charge $5. The truck still charged $600. Who's putting the $4,400 in their pocket? I can get an ultrasound for $300 that costs $2,800 at the system, and they're making money on the $300. I can get a surgery for $23,000 that I pay $70 or $80,000, and if I go to Oklahoma, I can get it for $16,000. We can do better. So one of the things we've done, part of our main strategy, is what I did at Merrill Steel, and what I'm doing now is don't go to the system, avoid it whenever you can, because there's no way to win there. They don't tell you the price, and then you get all these surprise bills. I won't read it, but there's an example here at the end of if construction were like healthcare, if you had a roof leak and you needed a roof, that's exactly how it is. That's not an exaggeration. If you have time, I would ask that you read that. So the better path is to talk in simply not insurance code, which makes no sense. If we had a 15-minute visit for 3 topics, but I'm charged for 3 different things, just charge me for the 15 minutes or the 30 minutes. That's what we do with the independent clinics. But we're finding all sorts of partners. We're finding oncology. We're finding cardiology. We're finding imaging. We're finding surgery. And that's where we're shopping with partners who, someone said earlier, high value. We're shopping with partners who share the price. And often their quality is better. The book, The Price We Pay, the research from Marty Makary said that the price is often inversely related to quality in healthcare, which is not an easy way to process things. So again, we're failing the do no harm test. One entity or type of entities that have control over a certain product or service always leads to price inflation and ultimately price manipulation. That's the fear here. We're making a bad situation worse. We're throwing fuel on a very hot fire. I would say we're approaching, or we're in an emergency state. We need to look at those things, and we need to make healthcare affordable again. So I guess those are my key points.
Thank you for your testimony, and as you were testifying, I was thinking I just listened when I do drive. I'm up in Tomahawk, so it's 3 hours twice a week, and I just listened to the price we pay. And your testimony kind of follows right along with that. One of the other things is I have friends now that go to Mexico, or I have a lady in our community that flies to Asia once a year, specifically for her health care, because she has chronic issues, and she has they're self-employed, and she has a very large deductible. So, sad but true. Questions for Senator Stasholt?
I heard you reference Oklahoma. Are you referring to the Oklahoma Surgery Center?
That's right, yeah.
I'm a patient there.
I've gotten to know the two owners, and I've actually been down there for a shoulder cleanup myself, which was about 6,000, which would have been over 25 up here.
I'd like to commend you on hitting what I think is one of the biggest problems in healthcare today. Probably 10 years ago now, I was in need of a non-mesh umbilical hernia surgery, pretty common surgery, and I had gotten divorced, and my spouse at the time had the insurance, so I didn't have any for a while, and I was going to pay for it. It's something I needed. So I decided to shop it out, and I went to 5 different hospitals in my area. 3 of the 5 told me they couldn't give me a price.
Exactly.
And 2 of them took quite a while, but I got the price, and one of them was somebody I actually knew and said, well, the surgeon said if I donate my service, it's still this much. And somebody told me about the Oklahoma Surgery Center, and I called down there, and I said, how much for that surgery? They said, well, look at our website, they're all
On their
listed.
website, yeah.
So you scroll through the website, and it was like $1,700, which was a tenth of anyone. So I got an airplane ticket, flew down there, got the surgery, flew back,
Right.
and I saved about $7,000.
They fly in over 600 people a year, and
Yeah.
so it's non-insurance.
It's a
and-
model that we should duplicate
Yeah.
in Wisconsin, but it's been frustrating since I've been in this building that there's some barriers to make that happen, but.
And we have some non-system ones, even in Wisconsin, that are within a few hours that are around 23 for that same surgery. That's a fair price. That's a
Yep.
reasonable price.
And you know what you're getting into when you leave.
And the surgeon that works for the Packers, and the surgeon that did mine does the Olympic athletes and the biking and swimming. I mean, these aren't,
Well, that was me.
Yeah.
Olympic athlete.
yeah, right, yeah. I always say it. I used
Everybody's
to be athletic.
laughing.
I'm
Little
just an old guy
humor.
now.
See, it's been
but-
a long day.
And I'd like to clarify, just as a quick point, when I point out those things with the hospital systems, my daughter works part-time still as a CNA. I'm not talking about the doctors, I'm not talking about the nurses, I'm not talking about the majority of employees, I'm talking about some people at the top. This is kind of a national issue as well. But there's a lot of great people in those systems, but they're doing what they're told. So I just want to point that out. But if you are working in those systems, and how would you like to shop to not and not see the price? I wouldn't call that the right thing to do. So
Any other questions? Thank you very much for your patience today and your testimony. Up next, we have Steve Massey, Westfield Hospital, New Richmond. And that's it. Okay.